That we wouldn't consider sustained 6 in this analysis is that all of these trials have the primary outcome of the difference in A1C. There's some secondary endpoints we'll talk about as well in terms of efficacy here. In terms of the basic characteristics or baseline characteristics, I think a few things are worth focusing on in this particular poster. One is that if you look at the duration of diabetes, you see that, as one would expect, in the treatment-naive group, they had a duration of 4.2 years of diabetes. In the next group, which was versus sitagliptin, it was 6.6 years, and then the others were all of longer duration, including 9.2 years for the sustained 3 versus exenatide, 8.6 years versus glargine, and then 13.3 years, so certainly pushed out a bit in terms of the insulin group, which is no surprise. So what that points out is that this was a spectrum of disease, and that's where it becomes important when you start to look at the A1C results over time, because what you see is this rather profound reduction in A1C that wasn't different whether you looked at the earliest patients or the latest patients, at least in any obvious way. So you went from 1.6, 1.5, 1.6, all the way to 1.8 in the insulin-treated group, the ones who had already been insulin-treated. So you have this persistent effect across the duration of different durations of disease, and presumably differences in beta cell function at that point. These are the estimated treatment differences, which you can look at later, but they basically are all significant versus the comparators in each of these different cases. And as you've heard, if we go to look at the same thing in terms of the composite, or the changes in terms of like what percent reach A1C goals, you can see that again, very consistent across time in terms of reaching those A1C goals of 7% or 6.5%. Always pretty dramatic differences versus comparators in each of the cases. A little bit of a dose response that's obvious across the spectrum of the different efficacy outcomes. And then in the end, the last thing that this particular poster also says is again showing the difference, the fact that there's very little difference in terms of hypoglycemia unless you get into the groups where you either had sulfonylureas involved or insulin involved. And in this inset up here, it shows you the difference that almost all the hypoglycemia, or a high percentage of the hypoglycemia that was seen across the ones that had sulfonylurea, or were in patients with sulfonylureas when that was one of the options in the background treatments. Because in the ones that didn't have background treatment, you didn't see significant hypoglycemia at all. And I think that's, so in final analysis, all this proves shows us what I indicated, that you get a consistent, significant, and a reduction in A1C across all these different groups with different durations of the disease, and always superior to the comparators. That's true whether you're looking specifically at A1C reduction or whether you're looking at the percentage of patients who gets to goal, which we would of course expect.